reception there. Obviously the diabetic nurses and the consultant, and so yeah, there was quite a team of them all helping.
The support has been very good at the clinic. I go every fortnight to see the consultant or the nurses, and they look at your diet, your blood sugar control, your doses, your lifestyle, anything that will help you get a good level and help towards the baby, the health of the baby and the pregnancy.
Usually whenever I attend the clinic, you initially see one of the nurses who takes the HbA1c, your blood sugar control, and then usually see somebody from the metabolic clinic to discuss the diabetes and the diabetic control, and then see an obstetrician to monitor the baby's growth. So one good thing is that you get to see the baby through all stages and get plenty of scans during the pregnancy as well.
The good news is there's plenty of help out there when you are pregnant. Your GP is the first port of call and can oversee your care right from the moment your pregnancy is confirmed. And one of the first things they'll do is refer you to the dedicated diabetes pregnancy support team based at your local hospital. This team is headed by a diabetes consultant to oversee your diabetes care, supported by a specialist diabetes nurse and sometimes a specialist midwife as well. A dietitian will help you choose a healthy diet and also help you deal with any sickness or vomiting or other problems you may encounter, such as anemia. An obstetrician will guide you through the various stages of pregnancy and will oversee the actual delivery. A paediatrician should also be available to look after your baby during delivery and treat any problems that may crop up. They will all work together to help you manage your diabetes right through the pregnancy. If you have any concerns or questions, just give one of the team a call. They'll be happy to talk to you.
After I became pregnant, I even got more serious with my diet because I don't want it to go anything under control, out of control.
Didn't see a dietitian or anybody, just would have eaten my normal food. First pregnancy was pretty boring. It was potatoes and bread because I was so sick I couldn't stomach anything else, just morning sickness. But just would have eaten my normal diet.
Well, I never thought my blood sugar was that well controlled in the first place, but the hospital said that they had been well controlled before pregnancy. Once when I was pregnant, I did control my diet a lot better and I checked my blood more often than what I was doing beforehand, so I wised up.
A healthy diet can really help you control your diabetes, and when you're pregnant it becomes even more important. Base your meals on breads and starchy foods like rice, pasta and potatoes, and of course plenty of fruit and vegetables. Eating dairy foods such as pasteurised milk, hard cheeses and yogurts will provide your baby with calcium and other essential nutrients. As we've said, it's important to take a 5 mg dose of folic acid during pregnancy. It's also important for pregnant and breastfeeding women to have enough vitamin D in their diet. And to make sure of this, you may be advised to take supplements containing 10 micrograms of vitamin D each day. Because you're aiming for tight blood glucose control, you may have a higher risk of hypos, so you'll probably need to snack more through the day. Choose healthy snacks if possible. Yogurt and fruit are great choices, especially if you're out and about. Your doctor and dietitian will be able to help you tailor the diet that best matches your needs and lifestyle. Although you don't need to go on a special diet, there are some foods you should stay away from. These include liver, pate, unpasteurised and soft cheeses, ready-prepared salads, and undercooked meats and eggs. You will also need to cut right down on your caffeine intake, and remember that includes tea, chocolate, and some soft drinks, as well as coffee. Vitamin A and cod liver oil supplements may harm unborn babies, so they need to be avoided too. It's important to know which foods to avoid while pregnant, but don't worry about missing anything. You'll be able to get a full list from your dietitian, GP, or midwife.
My main concern throughout the pregnancy has been blood sugar control. At the start, I was finding it hard to hit between 3.5 and 5.8, and it did worry me whenever I looked at my diary and I saw highs and lows, and I thought because it wasn't consistent it would lead to problems. But when I did go to the nurses or the doctor with my results, they actually told me I had nothing to worry about. I was getting there and the results to them were fine.
Emma has taken a number of hypos now, thankfully. None of them have got to the stage where she's reached unconsciousness. And I think that's more to do with me being about at the time, or somebody being about at the time, and knowing what to do. And that's crucial when you live with a diabetic. You kind of got to know what to do, no matter how difficult you think it is. And needles, I'm not good with needles, I have to say. I'm really not, and Emma will tell you that. But when push comes to shove and your wife is in a hypo about to go unconscious, I think you'll do it all right, and you'll draw the glucose and administer it.
Keeping a tight check on your blood sugar levels gives you the best chance of a normal pregnancy and a healthy baby. That means testing your blood glucose levels before breakfast and 1 hour after each meal, and, most importantly, before driving. If you're treated with insulin, you'll also need to test your blood glucose before going to bed. Ideally, your blood glucose level should be between 3.5 and 5.9 millimoles per litre before breakfast and below 7.8 millimoles per litre 1 hour after meals. Hypos are never fun, and when you're pregnant, they can become more frequent. You may also find it harder to recognise the signs of a hypo coming on, particularly during the first 3 months of pregnancy. To try and prevent hypos, take regular meals and snacks throughout the day, and make sure you test your blood glucose levels at least 4 times a day, and occasionally through the night too. There are a number of things you can get to help with hypos too. For instance, your diabetes team may give you a gel containing glucose to take if your levels have dropped, or if you're being treated with insulin, an injection of glucagon can be used. It's vital that, like Andrew, your partner or parent knows how to use these tools in an emergency. At the other end of the scale is ketoacidosis. As it can occur without you feeling seriously ill, this is a dangerous condition and, if not treated, can be fatal for the unborn baby at any stage in the pregnancy. Thankfully, this condition is rare, but if you're ill, vomiting, or if your blood glucose is above 10 millimoles per litre, it's a good idea to take a urine test for ketones. You can do this with ketone testing strips, which you should be given at your first antenatal visit. If the testing reveals anything more than a small level of ketones, you should go straight to your GP or a member of your diabetes team for a checkup and treatment.